Hello and welcome. This podcast is sponsored by Kinder Hospitals. This episode is all about children's bone health. Kids fall, tumble, and grow. But how do we ensure if their bones are growing right? In this episode, let's understand some common bone issues and also how to prevent them. As we speak to Dr. Jayanth Sampath, Pediatric orthopedic surgeon at Kinder Hospitals. Hello, doctor. Welcome.
Hi, I'm very happy to be here and thank you for the invitation.
Doctor, I'm sure this podcast is going to be very insightful because we're talking about children's bone health, being an orthopedic surgeon. So let me start it this way. What are the common issues that parents come to you?
So there are two issues majorly that parents come to us with. First are what we call physiological normal variants. So these are otherwise normal children who have some bend or twist in the bones, which is extremely common in the first 5 years of life.
Okay.
So when children are born, they have bow legs. And this is because children develop inside the womb within a very cramped space. So there is only a certain amount of space available for the development of the legs. And as you know, the uterus is an oval structure. So the baby that grows within it is also slightly oval shaped. So when the child stands and walks, typically around the age of 12 to 14 months, all the bones, they are kind of genetically programmed to straighten out. So all these little bends and twists in the bone, within the first 5 years of life, they correct themselves.
Okay.
So it is programmed into the growth of the bone itself. But when a child stands, if you see a big bend or a bow in the leg, obviously parents are quite concerned. So up to the age of about 2 years, to have bowing of the legs is quite common. This is called bow legs or genuvarum. And then when the child is slightly older, around 3 to 4 years, then it goes into the opposite direction. So they get knock knees, genuvalgum. But all of these problems in the majority of children correct spontaneously. Many parents and families believe that massage is quite essential for the correction of these physiological deformities.
But do they help?
Not really.
Okay.
So nature does most of the work for us, and I think the massage lady takes the credit for it. It may have some role to play in terms of relaxation of the muscle, etc. But I think there's no causal association between correction of these deformities or any massage that the family may be doing. Bowing is also common in the elderly. So the grandparent will have bow legs because they have knee arthritis. Correct. So naturally they tend to associate bow legs with some kind of
genetic association.
Or as the grandfather given something to the child. Flat feet are also extremely common in children. Again, this is physiological. Many parents come to us telling, should we put some arch support? Should we do some exercise, etc. But for the vast majority of children, all of these measures are not required. All of these problems tend to correct themselves. After the age of about 6 years, then we tend to take things more seriously, perhaps take an X-ray, make sure that the child doesn't have any vitamin D deficiency or rickets, problems like that. The other type of problems that we see are the more serious issues when there is something structurally wrong with the child, and we correct hundreds of different problems. By birth, we treat club feet. We treat children with dislocated hips, which happen at birth or soon after birth. We treat children who have cerebral palsy. This is where there has been some developmental problem with the brain. So the child, there is delayed development, delayed walking. We also deal with children who have fractures, injuries to the bones, and many other genetic, neurological, muscle problems. So there's a wide spectrum of conditions that we deal with. About 80% of the patients who come to my outpatient probably need just one consultation and reassurance. About 20% of children who come to me require some further investigation, treatment, etc.
You just mentioned about fractures and things like that. As parents, how can they prevent fractures or injuries?
So 2 aspects in terms of improving the child's bone health. The first is to give good nutrition. and that's very important. And I believe that a well-balanced Indian diet, it's been time tested over thousands of years. It's suitable for the Indian genetics. So a well-balanced Indian diet, and whichever part of India we are from, I think whatever is a traditional diet, I think that should be followed. That should be followed. That's the first thing. The second thing is vitamin D. And vitamin D deficiency, as you know, is a problem of alarming proportions, particularly in cities where we don't get enough exposure to sunlight. Children spend vast times inside the classroom where we don't have natural sunlight, and also at home, or they are in the school bus. So some amount of exposure to direct sunlight is important. We say that at least half an hour per day would be good. I think some amount of intermittent supplementation of vitamin D would be good. We recommend somewhere between 400 and 600 international units of vitamin D a day, which is essential for the child's natural bone growth and development. And children need even more, because adults, we have completed our bone growth, so we just need something for maintenance, whereas children are actually building the body, so their requirements are proportionately higher compared to adults.
Since you mentioned about diet, doctor, now there are a lot of health drinks that actually being advertised on television or could be social media, and kids endorsing it. Stronger bone, do this, do that. Do you recommend that as a
Not
parent?
at all. Not at all. I feel that nutritional supplements are artificial. So they do not maintain the balance that nature is able to provide. And I say that even the medicines we prescribe, they're all poisons, but given in the right dose. So that's why we, doctors stress on the dose, the duration, the frequency. So if you give it in the right dose, it's life-saving, right? Change the dose and, it can seriously harm health. If you can open a packet, put your hand inside and put it into your mouth, that's not good for you. All the food that children eat should go through the kitchen. Apart from salads or fruits, most good food has to be prepared by somebody at home and then given to the child. And I think that's the best long-term advice I'd give for good nutritional health in children. Children have more collagen in the bone. It's more resistant to breaking. And the mechanical properties of children's bone and adult bone is very different. So children are naturally resistant to injuries compared to adults. So they keep falling all the time, but they don't break the bones as much as adults do, particularly the elderly. Elderly have very fragile, brittle bones. So children are naturally resistant, but there are limits. If you exceed the limit, any structure will fail. And we do see serious injuries in children all the time. In the last 1 week, I've had one serious injury a day that required some form of surgical intervention. So it does happen. So parents should be careful. Next is the environment, which was the other thing I spoke about. And I think children do need supervision. It's important for children not to be wrapped up in cotton wool and kept at home in order to prevent an injury. Children should be fit, they should be healthy, they should be active. A fit, active, healthy child is a fit, active, healthy adult. And childhood obesity is a major issue now. So an obese child is more than likely to become an obese adult, and that causes long-term health issues when the child becomes older. So that is also an issue that we are trying to address as pediatric orthopedic surgeons, is to keep the children active. We recommend that a child should play, we call it aerobic exercise, but they should play freely, they should sweat. To the extent that they sweat, they should play for at least an hour a day, if not 2 hours a day. So somewhere between 1 to 2 hours a day of regular play, I think is essential for children's bone development and bone health and muscle development and overall general health. And I would say some form of adult supervision is important. When I go to apartments, I see that children are playing, by themselves. So I think if 5 or 6 children play regularly, I think one adult should take turns, maybe 1 day a week, and they should supervise, not interfere. I think children should be allowed, because a lot of social skills, important social skills are developed.
Most of the time we understand that incorrect posture also leads to bone issues, maybe pain or things like that. And especially when it comes to kids, right? We just tell them sit straight. Maybe they pay attention, they don't. Are there any hacks to fix this?
Posture was not an issue that was highlighted so much until the pandemic came. Before the pandemic, the guideline was any child with neck pain or back pain, it was always a serious cause. And then when the pandemic came and children got confined in, within the house and they were not allowed to play, there was an alarming rise in neck and back pain in children. So it was then that, as pediatric orthopedic surgeons, we came to realize that there is a role for physical activity, for posture, because they were doing online classes, they were sitting in front of a computer all day. So I do feel that with the insight we have gained after the pandemic, that posture is important in children. I think parents should, you can't keep reminding a child all the time, and the children will also get frustrated. So change the environment, buy them a good chair, buy them a good table. Make sure that if they are sitting at a table, whatever work they are doing, it is at eye level. So that just in order to focus on the work, the child will naturally adopt a healthy posture.
Doctor, we're almost at the end of the show. Just one final question before we wind up. I want to understand what are the signs that parents should not miss? So they should understand, okay, this is something related to this. Let me take my child to the doctor. Are there any signs?
Sure. So the first thing, in the first 2-3 years of life, the milestones are very important. So child should achieve all their motor milestones. They should sit by the age of 6 to 8 months. By 8 months, they should be crawling, they should be rolling. By 1 year, they should at least be able to stand independently or stand with a little support. And certainly by 18 months, the vast majority of children can walk independently. So by 1.5 years, if the child is not walking independently, and if by 1 year child is not standing, at least with some support, I would certainly consult a pediatrician.
Okay.
If the child has any obvious deformities or stiffness or tightness of the muscles of the leg or hand, or if there is any diminished use of one limb, I would certainly take those very seriously. The other common complaint in children is pain. So growing pains you might have heard of. This is normal. Growing pain typically happens in the evenings and nights. It happens in both legs and it never increases in severity. And it usually happens maybe a couple of times a week. So growing pains is something that can be dealt with by the parents themselves. Things we are interested in are if the pain happens every day, if it increases in severity over a period of time, or if there is constant pain. If the child wakes up constantly at night complaining of pain, so these are all red flags. These are all more serious causes of pain that should be investigated further. So, but I feel that most of these developmental normal variants that we see can be managed by parents. They can come and meet us once just for reassurance, and we can examine the child and make sure there is no serious problem.
Thank you, doctor. Thank you so much for sharing a lot of information.
It was a pleasure. Thank you.
You.